Hello. Hope that everyone is doing well and fighting off illness. Or not fighting illness at all, just that you're doing well. So, I want to give a tutorial on the material for the last 2 weeks. The reason for our discussions on these ideas, I am trying to, actually, there's method to this madness. We are about to embark on a study of theories over the next several weeks. And I want to make sure everyone has an appropriate framework, an appropriate scaffolding, matrix, whatever you want to call it, roadmap for navigating through those theories. So many times we in the graduate program stress upon you, choose a theory and stick with it. What is your theory of choice? So I'm trying to help you not only in family therapy, but also in possibly your individual therapy as well. Find a theory of choice, and so hopefully you'll find that I'm a little bit critical at times of theories, and I have, I think, over the years been embracing of evidence-based practice. Yet I want to make sure that I don't overly extol the virtues of evidence-based practice because it has limitations as well. So that's why I'm having you compare contrast. Now, I want folks to have a synthesis of these ideas at the end of the day. So that's what this is for. So I create a short PowerPoint. I'll post this on Blackboard as well. So this is an exploration of evidence-based practice versus traditional family therapy. So let's take a look at this and see what we can discern. And going through the PowerPoint very quickly, let's look at traditional models of family therapy first. So these are some characteristics of just traditional models. They're largely anecdotal. The information that we have from them comes from the experiences of usually the people that made them up. They're built on theory. Now, granted, the people that made them up, like Freud, Adler, Jung, you could go on down the line with different theories. They're built on the thoughts and the worldviews of these folks. So they're driven by the theoretical and epistemological underpinnings of the theorist. This is how the theorist is actually conceiving of the world and how people operate around them. So when we get to Salvador Minuchin, Carl Whitaker, a few others, you'll kind of see how their personality also, I'll put this one in there as well, it's also, they're also driven by the personality of the theorist. If you dig down, a lot of the personality comes off in, Virginia Satir is somebody who I'm thinking of there. Their personality comes off in their theories, in their family, in their models of family therapy. Now, there's things that these theories lack, and we should be aware of this. We should be very keenly aware of this. So they're lacking controlled trials. As I said up there, they're anecdotal. Okay, well, it worked for Sally and Joe, so why didn't it work for everybody? So they don't necessarily have the same. They don't necessarily have comparison groups, largely speaking. Now, I think when you get into some other models, maybe they may closely resemble evidence-based practice like CBT, but we'll get there in just a minute. But generally speaking, they don't have comparison groups and they don't have a lot of scientific or empirical scrutiny. So it's basically, take my word for it that it's worked on the folks that I've worked with, so it can work for you too. I may be a little bit dismissive, a little bit too dismissive, but honestly, when it comes down to it, when you study them, it is largely driven by the worldview of each one of these theorists, and worldviews have evolved over time. We don't live in the same world that Freud did, or even B.F. Skinner did. So, be thinking about that. I don't know that B.F. Skinner actually has any propositions for family therapy except for rewards and reinforcement. So, anyway, let's jump into evidence-based practices now. So here's where our contrast is going. Characteristics of evidence-based approached. My goodness, yeah, I threw this together really quickly. Evidence-based approaches to family therapy. They're built on theory. So you're like, well, that's no different than the last slide. No, evidence-based therapy is usually built on a theory, a theory of the world. A lot of CBT models are out there, cognitive behavioral therapy. They're also largely driven by the theoretical or epistemological understanding of the theorist. So I included Carol Comfort this week. There are a lot of other models out there. There's celebrating families. There's active parenting. I think there's also, what is it, Love and Logic, a couple of others. And these are all fine and great, but they're still borrowing on that worldview of the therapist to put them together. And so they're also driven by whether this group would say no, they're not driven by my personality. They're driven by the evidence-based approaches are driven by research. And so these are two things that you won't find in just traditional family therapy, generally speaking. They're not, these are empirically and scientifically studied. So when you're looking at all the Strengthening Families resources I have out there, they have actually delivered these things in this way, in this manner, with people, and measured their responses to them. And so, largely like you would study a pill for depression, you have a control group, a comparison group. So a lot of times they don't have a true control group where they don't help anybody, but they'll put them in something called treatment as usual. So they'll put their approach up against something called TAU, or treatment as usual. And many times the theorists who are trying to substantiate, hey, my theory works, my evidence-based approach works, they'll perform better than the treatment as usual. And so they'll also compile this quantifiable. That's the key word. It's bold. They have the numbers to back up what they're saying, that, hey, this works. These people, their anxiety went down. These folks, their anxiety stayed high. These folks over here in my group, and that I was giving them my theory, my evidence-based approach, their communication went up, their conflict went down. The family over here just kind of stayed the same. They didn't really see an impact. So that's what they're saying. With an evidence-based approach, you're giving some numbers, you're backing up with data, with quantifiable data. The problem is, and so this is kind of a swing the other way. This has happened in probably the last 10 years in looking at evidence-based approaches. They lack a lot of flexibility. When you go through training for celebrating families or strengthening families, active parenting, Love and Logic, they don't give you very much of a window to operate. They say you deliver our model this way because this is, it's been evidence-based. It's evidence-based. It's been empirically shown that you have to deliver it this way for it to be effective. And so when you do that, sometimes you lose flexibility. You can't start operating outside the bounds out here. And there's also been not always been a consistent, sustained focus on the relationship between the counselor and the families or the clients. That's another, in other words, we get very technique driven, but we don't necessarily care too much. Well, it's a byproduct. Again, I've got a scientific study that says if I give these particular methods, these evidence-based techniques, this is what's driving the change. The relationship is secondary. And so there's been some research emerge in the last 15 years that, or maybe 18 years, that contradicts this, that says, hey, this isn't quite right. And so this is me sharing, late in the week, this is me sharing that article by Wampold. And so this is where I'm going. There are two main points if you're working your way through this. There, according to Wampold, who's done a meta-analysis over many, 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 many years, picked up by other researchers now. You see Wampold's name coming up again and again and again and again in the research. He's not necessarily coming up with something new. This has been around since the 1930s when people started looking at, hey, what's making this therapy thing work? A person by the name of Hansen also picked this up, wrote a big textbook about these things called common factors. What is it about these evidence-based these evidence-based practices, and even when you have treatment as usual that you see an impact? What is it about these things that make people improve? And so Wampold looked at all the evidence-based practices, their evidence-based studies where they're trying to have a control group, they have a comparison group, and they're saying, hey, ours works better. There's two things he was able to discern in all of this meta-analysis that Wampold was doing. Number one, change is driven by a real relationship between therapist and his or her clients, or client, or family. And these things, a real relationship is marked by three factors: empathy, sounds a lot Rogerian; positive regard, again sounds very Rogerian; and congruence and genuineness. It sounds like Wampold is a disciple of Carl Rogers, and that theory. So client-centered. But there's a lot. I mean, when you look at the evidence, there's a lot of weight to this. What Wampold says is, yeah, you can deliver techniques, and in a very small percentage of cases, like deep breathing and meditation, that's what's helping drive the change. But otherwise, in therapy, it's these common factors. It's this: do you have a bond with your client? Do you have a bond with your family that you're working with? Do they know that you have their best interest in mind? So he talks about something called an alliance and expectation. So the alliance is built with that real relationship. Somebody that thinks you're superficial and really don't give a rat's ass about how they're going to do. I just care about you learning about these techniques. They're not going to do well in therapy with you. I'm just going to flatly say you need to establish a bond and work on that. Be it a family, be it an individual, be it a child, it doesn't matter. And number two, there has to be an expectation. The client has to have an expectation that their time spent with you is going to, or the techniques that you are giving them are going to result in a positive outcome. In other words, they've done a lot of research into placebos, and the placebo effect is real. If somebody comes in and they get the sugar pill along with the Zoloft, they see an effect in the people that took the sugar pill, because they're truly believing, I feel better. This is the Zoloft. I'm not the control group. I'm getting the sugar pill. I know I'm getting better. I feel it. And so we see that in study after study after study, and not just these, but also the ones where the treatment as usual, where I see a benefit from this, and I think I'm getting a benefit, so I am. And so these positive expectations have a lot to do with how well our clients do. And lastly, and most importantly, we have to believe in it as well. That if a client comes to us, that we have something that can help them get better. So this is why when Lee is talking to you and I'm talking to you, we're really trying to impress upon you, pick a theory that fits and works for you. Pick and something that is meaningful. I'm going to stress evidence-based practices, because I really think there's something to, learning that deep breathing, learning that meditation, learning these different techniques, changing the way that you're communicating with your spouse. If you can deliver that in an empathic way and you believe in it, your folks are going to change. The families are going to change. Your clients are going to change, and you're going to do something to make the world better. And that's why we're all here. So I think that's my main point of this. That's my main point of giving this, is that you have to believe in what you're doing as well. Because if you don't, your client's going to pick up on that. Either your nonverbals, how you're speaking. You have to believe in what you're delivering. And you're not going to believe it on day one. You're going to be all Rogerian, because I was. I know, most people are. But through practice, through time, remaining consistent, that belief in yourself and what you're doing is going to help drive the change too. So I hope this has been helpful. I wasn't trying to be too obtuse or elusive in what I was trying to put out there, but this is the nuts and bolts, and this is why I did it. So the next few weeks we're going to talk about individual theories, but I want you to have this as a roadmap, as a matrix to understand what you're reading in the subsequent weeks, and how to make decisions on, hey, what works with me, what fits with me. See ya.